Ramie procedure go, thoracic phase, operating room configuration. For the thoracic phase, the patient is placed in a left-sided semi-prone position with the table breakpoint positioned at a level corresponding to the tip of the patient's scapula. A 30-degree break is then applied to the table. The robotic system is then placed towards the patient's dorsum, whilst the table-side assistant is positioned on the opposite side. The console is positioned in the corner of the operating room. If dual consoles are available, the primary surgeon operates the console that is orientated towards the patient. Port placement. Prior to skin preparation, skin markings are made to aid with port placement. Key landmarks include the tip of the scapula, marking the 6th intercostal space, and the posterior axillary line. The camera port, for use with the third robotic arm, is placed in the 6th intercostal space, approximately 1/3 of the distance between the posterior axillary line and the tip of the scapula. From this point, the remaining ports are positioned under vision in a curvilinear fashion, with the port for the first robotic arm being positioned in the 10th intercostal space, the port for the second robotic arm positioned in the 8th intercostal space, and the port for the fourth robotic arm being positioned in the 4th intercostal space. The assistant port is then placed between the third and fourth robotic arms, immediately dorsal to the posterior axillary line.